is Dr. Nina. I'm the Executive Director of TOVA Community Health, a primary specialty care clinic in Delaware that serves the needs of individuals with sickle cell anemia, trait, and other complex chronic conditions. Today on Your Health Matters, I have a renowned primary care provider here to talk about aging with dignity and gracefully. We have Dr. Stephanie Malleus, which is the co-owner of Family Medicine at Greenhill, who has over 30 years of providing primary care to individuals in the entire community from diverse perspectives and backgrounds. To like us, please go to our website at www.tovacommunityhealth.org. You can also like us by hashtagging TOVA Community Health, or go to our Instagram by hashtagging TOVA Community Health. So without further ado, on Your Health Matters, all matters containing to your health and wellness to improve your overall quality of life, we have here Dr. Malleus. Good morning, Dr. Malleus. How are you today?
Well, good morning, Dr. Nina. Thanks for having me on this show. I haven't done this before, but it's been even been interesting so far. I'm very well this morning. Thanks.
Thank you so much for coming today. How are you?
I'm well, thanks. I'm happy to be here. It's a beautiful day.
Yes, it is. It's a very beautiful day, and as you know, one of the things I wanted to have you talk to our audience about is the process of aging with dignity. One thing that we know for sure that we all are going to grow old. And one of the things that I found is even with my grandmother, who just passed away last year at 98, but lived at home, all of her life, is that as we grow old, we want to age gracefully. And one of the important processes in this is making sure you have access to a good primary care provider. So Dr. Malleus, tell me a little bit more about your background and why you became a doctor.
Okay, well, that's pretty ancient history, actually. And I can tell you why I became a doctor, but I can tell you something more important is why I became the doctor I became, or I have become. And I think it really is a function of the people and the mentors that I've been exposed to. Mm-hmm. For whatever you sort of get into this business of and it's very complex, of taking care of people and trying to figure out how best to do that. I think I've considered myself very lucky for having had some very, very good mentors, people who have helped me along and given me some of the values that I try to practice by, and giving me some, not just the medical knowledge, but the understanding of people and the understanding of how best to care for people in different situations. And I think I just graduated from college, from Brown University, and then went on to Thomas Jefferson University, which is very local here. I mean, many doctors from this area have gone to Jefferson. And then did my first year of training in New York City at St. Vincent's Hospital, which is no longer a hospital, but it was a venerable old place, and I enjoyed it. And then I finished my training here in Wilmington at what was then the Medical Center of Delaware, which has now become Christiana Care. Mm-hmm. So, and I've been here ever since then, and mostly been practicing in the city, partly in Browntown, and now we're on Lancaster and Greenhill. And so we've been in the same sort of 2-mile catchment area for my whole practice life, and I really love it here. It's been very, very interesting. It's taking care of people in the city is well, we have a bit of a mixed practice. We have people from the city, from the suburbs. We have a very diverse practice in terms of where people come from and what their ages are, what their backgrounds are. So I've always enjoyed that as well.
Yeah, and I also want to say that you have like a very diverse background of patients that you provide care for. So some of the most vulnerable those who reside in group homes to some, young ladies who live at the Bayard House that are teenage mothers. You want to talk about that?
No, because I think my point in the practice is mainly taking care of older folks. We have a very good staff here, and many of the people have special interests. And one of the doctors and nurse practitioners, Dr. Gill and Amanda Bostic, are particularly interested in families, children, and women's issues. And they take care from that they have gathered from Bayard House, which is a program for women who need support. There's mostly women who have support through their pregnancies. And that place provides shelter, provides training, provides help for them planning to go forward, and what to do to raise their child and to provide for them. And so they work with that program and take care of the women and children from that program, and also work quite a bit with the birth center and take care of families and children from that we know through the birth center. And then we have some children and families that we take care of that have been with us for years. We have families that we've taken care of for 2 and 3 generations.
Right.
And we have guys from that group as well. So we do quite a bit of pediatric practice here. As I said, I'm more involved in the senior end of things right at this point. We also have home visit.
Yes. And that's an important part of seniors, right? Having that service for some seniors.
We have a nurse practitioner and a physician who will go to the homes of people who have trouble getting out to come, into the office. So the practice also is quite diverse in terms of the people who are here. We have also one of yourself who you help us with patients here and having your interest in sickle cell anemia. And then one of our other nurse practitioners has a great deal of interest in the LGBTQ community.
Yes.
And so we try to provide as diverse an offering as possible for the people who might come here. We really say that we see people from birth through seniors, and it doesn't have to be. It's a family practice, but sometimes people kind of get hung up on the family part. We all have some type of family, whether it's by genetics or whether it's by intention, and we take care of single people and as you said, people from group homes, seniors, just about everybody. Right. That's kind of what makes it interesting. So
your area, I just want to recap, is right now is I see your unique niche of taking care of the seniors, and they're very complicated population of individuals to take care of because they have such unique needs. But what I wanted to segue in is, as you know, there has been a drop in independent practices over the last, I would say, 2 to 3 years, though Delaware healthcare costs have been ranked as high as 3rd highest in the nation. Can you talk about that, and what is the paradigm shift going on in primary care, and what do you foresee in the future for independent practices?
Right. Well, I think probably most people in the community don't really differentiate between independent practices and owned practices, and it's not a distinction that a lot of people make, but for us, it's a very important distinction because we belong to an independent practice. We are not owned by a hospital or a corporation, and we don't really have an allegiance or a secondary kind of necessity to feed someone else's program. We make our own decisions, and we make our decisions based on what's best for our patient population and how we feel we can best care for them. there has been a move, I think almost nationwide, for primary care practices to be owned by hospitals, particularly, and other large organizations. And this is a little problematic for me because not only do I, it's really been studied and shown that your scope of care kind of shrinks, like what you do in primary care practice becomes less when you're owned by a corporation because they don't want you doing things that you might be interested in doing, but that they don't really support. And they also, it's also pretty clear that a lot of larger organizations kind of see primary care as a way to kind of feed their feed their emergency room or their, keep their hospital beds full. And for our purposes, our main thrust is to keep people out of the hospital and keep people out of the emergency room if they can. I mean, if hospitalization or, emergency care are necessary or appropriate, we take advantage of those, of course, and encourage people to take advantage of them appropriately. But we try to be available. We try to provide care that is consistent and tends to keep people well and out of the hospital. And we try to handle as much as we can in the office so that people don't spend a lot of time, sitting in the emergency room. So, and we try to have broad hours. So there is some difference in independent practices and owned practices. And we're quite committed to trying to keep our practice independent and make the environment in the state one that's conducive to having independent practices. Yes, and how that gets supported depends a lot on the individual state that you happen to work in. And Delaware has never been a particularly good state for independent primary care practices in general, but that's changing. And there have been a couple of legislative initiatives and a couple that are still, working their way through the Delaware legislature to try to support, put independent care on an equal footing with hospital-owned practices. For instance, we get paid a lot less per visit than a hospital practice does. It's just a thing in the payment system, and a lot of it has to do with that. But basically, they want to kind of even that out a little bit more, and they want to kind of make sure that the insurance companies are putting their resources where they're going to be best used. I mean, it's been very well studied in many countries, and countries who focus on primary care as opposed to specialty care have much better outcomes medically,
right?
And they also have much lower cost. So Delaware is understanding that, and they're really trying to put more resources into primary care as opposed to specialty care to try to improve our outcomes and lower our costs. And we're hoping that moves forward. Some of it already has, and we're hoping that that it continues.
Yeah,
but I've been, I'm sorry.
Go ahead.
No, I've been very impressed with the Delaware legislature and their ability to kind of understand the complexities. They have an awful lot of different things to understand about an awful lot of different areas, and they've been very willing to kind of really try to understand the complexities of this particular issue. And I think it's a very important issue for all of us in Delaware because as we have medical needs, and particularly as we age, we want to be living in a place that understands what we need and how to get it for us.
Right. And I don't know if you're aware of that in Delaware healthcare costs, we expend about 25% of the state's budget just on healthcare spending. So that is not a sustainable path forward. And as you said, that access to primary care and high quality care helps to lower costs, and that's been proven of other healthcare systems around the country. So this is something that I'm glad the state legislators are getting behind. But also, Dr. Malleus, I don't know if you are aware also that Delaware's population is older and aging faster. So it is predicted that by 2025 will be the 10th oldest state. So I wanted to ask you, since your area of interest and expertise is in working with the senior population, how do you explain that, and also the importance of having insurance and the difference of insurance policies that seniors may have?
Right. Okay. So there are many ways to be insured, and unfortunately, someplace back there historically, insurance for people under 65 got linked up with employment, which is a very bad system, because many people are not employed in jobs that are linked up with insurance, and so they don't have insurance, and that's sort of another topic, but and a problem. But once in this country we hit 65, most of us are appropriate for Medicare. Medicare covers individuals over 65, and it also covers some people who have disabilities. And it's actually very good insurance. It covers a lot of the basics. Of course, there's like any insurance policy, there's a deductible, and there are percentage of services that one would pay for, but Medicare is really quite good about covering the basics, and many people who choose to and can afford to will get a secondary insurance that covers everything that Medicare doesn't. And there are a number of places that most of the insurance companies, as well as the AARP, the American Association of Retired Persons, they offer secondary insurances at well, reasonable, depends on the individual, but what most people consider reasonable rates. But even if you just have plain Medicare, it's pretty good coverage. Medicaid, on the other hand, is a program that is more for people who have a lower income, and you have to qualify for Medicaid based mainly on income, and many people do all along qualify for Medicaid and then switch over to Medicare when they hit 65. And also some people use Medicaid in between employment, like maybe they'll have a job and lose it, then they go on Medicaid for a while, and then they are employed again and go back on some other insurance. But Medicaid has been expanded to include more people in many states as part of Obamacare. And that's been a very good thing for many people, because it's just expanded the number of people who are insured. Many of the politicians these days are talking about Medicare for all, and that's just one way, I think, of getting to what we call universal health care, which is some kind of system in this country where everybody is covered. And that's certainly where personally, and many people agree that we should be moving. Everyone, regardless of whether or not they're disabled, whether or not they're one age or another age, and whether or not they're employed, should have access to health care. It's just a basic right, I think, in a country that's as wealthy as ours. Everyone should be covered for health care. And the other very practical part of that is that, if my neighbor is ill, that affects me. It affects everything about, it's a community. Our health is not just an individual issue; it's a community issue.
Right.
So having access to health care is also a community issue, so that's how currently Medicare and Medicaid work. And then there's, of course, the CHIP program, which is the Children's Health Insurance, which is like Medicaid, but it's a little bit broader than Medicaid and covers younger children. But yes, and how that insurance is, or how care is provided is a very big topic, and one that we all should be following and making ourselves heard about, I think, because as I said, I think it's important that everyone have access to good health care. Yeah, we certainly don't like having to take care of some people and not take care of other people because they're not insured. It's
Right.
not reasonable. Yeah.
And I also want to say that at the practice, you really have set a culture where all of the providers really try to provide high quality of care to any individual that receives services in your practice. And I think that's to be commended. But I wanted to ask you is, for services or your unique way of providing care to the seniors, what would you say is something important that you want to share with the audience? One of the things I've noticed that you have such a personalized relationship with your patients or clients. Can you talk about that and why it's important to have that, especially as you're aging with dignity?
Right. I've been working with a great number of the same people for 30 years now, and frankly, I consider them, more than patients. They're friends. They're family in a way. And
so you're a community doctor. You're a community doctor.
Doctor take care of other members of their family.
Yes.
And that's been a great privilege for me, and it's been a great deal of what makes my practice meaningful, for me. When you're talking about aging with dignity, I prefer the phrase "aging with grace," and I know that. I think if you try to age with grace, it brings dignity to the process. I mean, there's not a lot dignified about getting old. I got to tell you.
Yeah.
And I'm sure a lot of your listeners understand that too. That it's a really rough time for some people, but there are points of light in it. And I do think if we look for the spots that do improve, sometimes our judgment about other people improves, and sometimes what we can offer to our families improves, and our experience and our place in the community change, but are valuable. I think very valuable as we get older. I think aging with grace to me sometimes means giving up some things. It's like not insisting on climbing up on that ladder to change those curtains every year.
Mm-hmm.
You get something to do it as much as you don't want to. You realize your balance may not be quite as good, and if you fall, the consequences are so much worse. You just sort of say, yeah, let's get Charlie to do it. They'll be happy. They'll be happy to be able to come over and feel good about the fact that they could help. So sometimes it's sort of like letting go of some things. It's one of the things I discuss a lot, for promoting independence and living safely at home, is that you have to plan ahead. You have to have a plan B, because none of us is getting younger, and none of us is getting more agile or more able. You have to sort of say, well, if I need more support in the next year or the next 5 years or however far ahead, how am I going to get that support? Are there family members who can support me at home? Do I need to think about providing a place for a younger family member to live so that they can be with me and support, and we can support each other in
Mm-hmm.
living? Or do I need to think about bringing in a home health care agency?
Mm-hmm.
Or do I need to think about assisted living or a higher level of living in a higher level of care? And I think being graceful about making those decisions and saying, it's really tough to give up my digs. It's really tough to share my home. It's really tough to leave my home, but my life will be better for that. And sort of when that's the case, sort of facing it, and in that way, getting to make your own decisions as opposed to having somebody else make those decisions for you. Because if you end up in a situation where you're very ill for some reason and you have to make one of those changes, you don't get to make the decision. We get to make our own decisions when we're well, and when we're thinking, and when we're making good plans and good decisions. So it's good to take advantage of that, you know, and be proactive a little bit. And sometimes in our own homes, you know, we can take advantage of things like occupational therapy. There are people who are actually trained. Your doc can get a referral for you, and people will come into your home and say, you know, you could put a grab bar here, and it would be really helpful for you. Or you
especially on the shower, where, you know, slip and falls can happen, you know.
Exactly. You know? Or you want to move this rug, this little rug from here because it's easily tripped over. Or
right.
You know, you might want to chair of a different height that allows you to get up and down a little bit more easily. You know, that they have some wonderful suggestions. And so taking advantage of that kind of input is also, I think, really helpful. But, you know, those are some of the things that we discuss. I know one of the things that you asked me earlier was about advanced directives.
Right. And when is a good time to discuss that?
Well, frankly, I think the best time to discuss advanced directives is when people start driving, you know, around age 16.
Wow.
I really think everybody who's an adult, or at least 18 when you're an adult and making your own decisions, is really important for everyone. You know, we sort of ply all of us senior citizens with this request, but frankly, I think there are other segments of the population who really need it. And the way I look at advanced directives is that they're really a gift to your family in many ways, because they kind of they kick in two situations. They kick in, number one, in a situation where you're unable to make your own decisions, where perhaps you've been in a major accident or had a major stroke or something where you're unable to make decisions. And also, they kick in when you're not expected to survive. You know, if you're expected to get better, everybody does everything to get you better. You know, nobody's going to say, well, she didn't want to go on a respirator, but she just has a pneumonia. We think she'd get better, you know, if she went on the respirator, but we're not going to give it to her because she said she didn't want it. Well, that's not what happens. If you're expected to improve, everything's done to get you to improve. These really kind of kick in when nothing good is expected to come from your situation, or of our situation. Anyway, so that should be understood. And the other, so it does two things. It designates an individual and a second individual to make decisions in your place. And the second thing it does is it kind of gives a little bit of a roadmap for what kinds of decisions you prefer. And I see it, as I said, as a gift to your family, because when we're in that kind of situation, when we're sick enough that we're unable to make decisions and trying to figure out what to do for a person, families are at a terribly emotional time, and
yes,
a very high anxiety kind of time. And if you provide direction for, this is the person who's making the decisions, it doesn't need to be discussed, I've decided that, and you leave a little bit of a roadmap for what kinds of decisions, it really takes a lot of the anxiety from your family members, and it allows them to kind of not have so much tension when they interact with each other, and it kind of leaves them feeling like they're in that they did the best for you and that they did what you wanted. And I think that's a really important thing.
Yes. And so I really appreciate you sharing that, you know, talking about advanced directives shouldn't be when someone is sick, but when your loved one is well, and actually having the conversation as young as 18, I think is a fantastic recommendation you're providing, because a lot of times we react when situations are at a very trying time, and that's not the best time to discuss these matters about your health. But when you're talking about seniors promoting independence and living safely at home, you mentioned some really good tips about making sure that the rails are safely secured on your shower. If you have throw rugs, that maybe your elderly individual could trip over, that those can be removed. Do you have any other suggestions? that you tell your clients or your patients?
Well, just making homes convenient and safe for yourself. What was convenient and safe when you were 20 isn't the same thing that's convenient and safe when you're 80. And having place to sit in places where you want to sit, or even like at the sink. If you want to be at the sink, maybe you need some support to be there. The types of things, a lot of us have back problems and spinal stenosis as we go along. And, those cushy, soft, comfortable couches are not our friend. And it's much better to have something that's firmer, that has a straight back and a seat. So some of us are sort of sitting in couches that we've had for years that are really making us hurt more. So looking at things like that, and looking at having a broad and clearing out some pathways and spaces so that it's easier to get from one place to another without bumping into things or knocking things over. Being a little bit flexible about reconfiguring things, I think is helpful.
Wow, that is really important that you mentioned about having a firmer and a straighter back chair that is comfortable. But I also want to say that also with your seniors, do you recommend them changing light bulbs?
Changing light bulbs?
Yes.
You mean like for higher light bulbs?
Yes.
Yes. I'm frequently. Yeah. Now you're gonna ask me about which light bulbs, and I'm not gonna be able to tell you. But
in general.
Yeah. Many of us see with need much better light to see well. And so having like soft light is not always good if you're trying to read or see something specific. Getting a brighter light on things is very helpful for many people. Yeah.
So that's very good too. But I was just mentioning that sometimes seniors, as you were saying, they want to be independent. And so they get up on a ladder. This just happened with my mom, and she wanted to change a light bulb. And I said, Mom, no, that's not a good idea to do that. You need to get someone else to do that for you. So sometimes they want to do things to keep them independent, but that also puts them at risk for fall.
Right, and that's what I was talking about with like changing curtains or, light bulbs are the same, or going down the basement steps frequently is a problem. Especially in city houses, I've had a lot of people who, if you need to go down to the basement to do your laundry, make sure there's a banister, and make sure there's good light and good footing. And if you can, put a small washer dryer like on the floor where your bedding is and where your clothes are, so you don't have to be carrying them up and down. So sometimes making investments like that in our homes, it seems expensive, but it saves a whole lot of trouble. So having a washer and dryer, even a little stackable unit in a closet on the floor where most of your laundry is a much easier and safer way to handle laundry. And as I said, same thing with home repairs and things like light bulbs. You want somebody else to do that for you if you can. Making sure there are banisters, like handrails in places where you need them. Those can save you tons of trouble if you have them.
Right. Thank you so much for that point. I also wanted to segue, Dr. Malleus. As you know, we're living in very uncertain times, and even as healthcare providers, we're on the front line providing care to our clients in the most vulnerable situations. Do you have any tips for how to stay mindful and balanced?
Oh, yeah. I think that with everything in the world going on today, and there are just so many things that are being layered upon us at this point, that it's really important to try to keep our center balanced, to kind of keep our heart steady and focused on what we think is most important. I think it's very easy to kind of get diverted and troubled. And some of us, and especially seniors who, you might have a great, urge to go out and be in the streets and speaking, but unable to. And I think sometimes as we get older, our place is really to provide support for the for those around us, and to provide some kind of center of calm for the people around us. We have to kind of be a little bit of an island of more gentle energy. You know, I think I think it's important to speak out, and I think it's important to be heard. And you know, speaking out and being heard at whatever age is very important. But to be careful doing that, I think, is also important. Not to be putting yourself in the path of physical danger, and not putting yourself in the path of being more exposed to like this COVID virus. I mean, if you're going to be going out and you're going to be doing things, make sure you're wearing a mask. Make sure you're washing your hands, keeping your distance.
Mm-hmm.
It's just very, it's very gratifying and inspiring to see people out protesting these days and making sure their voices are heard about issues that are important to them and to all of us. But it just concerns me to see people in large groups with no masks, you know, all together. So we have more than one thing going on at a time, and need to be mindful of that, you know. And the other thing that you might want to do is, like, try not to let it all be too upending. You know, turn the TV off once in a while. You know, you just really have to limit how much biased, anxiety-provoking information you want to let in. And how many politicians you want to let get under your skin. You know, you have to step back and say, you know what, I need to know what's going on, and I need to, like, you know, maybe call my legislator. I need to maybe get outside and put a sign out, or, you know, even be out in the crowds, or I need to, but we need to be very careful. We need to kind of, like, limit our exposure to all of the overstimulation that we get, and all of the distraction that we get.
Yeah, because that provokes anxiety. It does. It gets you agitated and irritated.
Absolutely. Focus on what's important, and you have to try to be centered and steady, you know, about how you respond to it, and not let it upset you to the point where you can't function very well. You know?
Right.
Yeah.
Thank you for that. And I think those recommendations will be very helpful to those in the community, because we're under such stress for these uncertain times, and people just don't know what to do or where to go. So just knowing that that there are ways in which we can stay mindful and present, because that does affect our physical health as well. But we're coming to a close, Dr. Malleus, and I wanted to ask you, what do you think your legacy will be of all of the years you've been providing care to families that love you so dearly and really appreciate your personalized approach and your dedication as a community doctor? What would you say that would be?
Well,
I have my ideas, but I wanted to hear from you.
I think the best way for me, I mean, like, and we all think about, I guess, what we want to leave to the next generation, but I think the most important thing for me would be teaching. You know, I involved a little bit in teaching at St. Francis, the residency program there, just an afternoon a week. But we also teach in our office. We teach students, nurse practitioner students, and residents, physician residents, and physician assistant students. And I think trying to convey what's important to me about people and about practice. I really do think teaching is probably teaching the next generation is the best way to lead it. And mentoring, as people mentored me, I want to try to mentor other people. And I think that's the best way to leave a legacy, is to leave a mark and a thought for the next generation.
Yes, and I definitely appreciate all of the wisdom and knowledge and clinical expertise that you have shared with me, and I've learned so much just being around you. So I definitely try to soak up as much as I can as well. But I want to
Oh, and
thank you for coming. Do you have any last minute comments? What were you saying, Dr.
no,
Malleus?
I just wanted to thank you, and I just wanted to say that that information and that teaching goes in the other direction as well.
For sure. We never stop learning. That's for sure. So, family, I just want to thank Dr. Malleus for sharing such a wonderful wealth of knowledge about aging gracefully with dignity. I want to encourage all of you to make sure that you have a primary care provider and that you at least once a year set up a wellness visit with your primary care provider. If you like this episode, please visit our website at www.tovacommunityhealth.org. You can like us on Facebook and Instagram, where we will be posting Your Health Matters. Dr. Malleus, thank you so much for coming on our show today. I really appreciate it, and I'm sure the community does as well. I hope you stay safe and have a blessed day. Take care.
Thank you, Doctor, and thank you for all you do.
Thank you. Take care.